Hello students. Welcome. I didn't go anywhere. I'm here. I'm here for you. You know who I'm talking about. I'm here for you. So, I'm reviewing the musculoskeletal part, okay? And this is going to be helpful not only for any a review that you need to do now, but also for the NCLEX. So you need to know your basics about musculoskeletal, and then you need to know more advanced questions. And with that material, you can focus on answering more challenging questions on the NCLEX, right? They are going to bombard you, they are going to hit you from different angles, and you basically need to know your basic information. Okay, so let's review a couple of questions. I'm going to be doing several videos in musculoskeletal, average 20 minutes, so you can hear, you can review when you are walking, driving, commuting. Okay, here I am for you. A nurse is performing a musculoskeletal assessment on an older adult. What normal physiologic changes of aging does the nurse expect? Select the 5 that apply. So for example, you have the muscle atrophy, you have the slow movement, kyphosis, arthritis, weakening gait, decreased joint range of motion, and the answer is all. Okay, I know it says 5 that apply, but the answer is basically all of them. So muscle atrophy is going to be a major part. Slow movement, of course, if you are aging. Kyphosis, remember, patients are going to start decreasing stature. Arthritis also is the inflammation of the joints, weakening gait, and decreased joint range of motion. Next question. A client returns to the post-anesthesia care unit PACU after arthroscopy to repair a shoulder injury, right? What is the nurse priority when caring for this client? So are we going to keep the affected arm elevated and immobilized? Remember, this is arthroscopy, means that there was a procedure done in one of the joints. Okay, so keep the affected arm elevated and immobilized? No, you want to keep moving, right? Ensure that the client uses the patient control and anesthesia pump. Okay, is this a priority? We need to check for neurovascular status of the affected arm. Review your neurovascular status, because there's one in which the patient is going to feel numbness and there is going to be a decrease in pulse. So that's a no. That's why we need the joint to keep moving. Okay, instruct the client to stay in bed for 24 hours. No. So the answer is check the neurovascular status. Now let's go to the following. The nurse is preparing to teach a client about how to promote musculoskeletal health. Okay, which statement will the nurse include in the teaching plan? If you smoke, you need a smoking cessation plan. Avoid drinking excessive alcohol. Be sure to take in enough calcium and vitamin D, right? Avoid high-risk activities that could cause an accident. So let's start with the question. In this review that I'm going to do for future NCLEX and your current needs, okay, my biggest suggestion is you start reading the question on the question. For example, which statements will the nurse include in the teaching plan? So that is the question. That's the most important. Don't get distracted with any other factors, okay? It's a teaching plan, okay, to promote musculoskeletal health. So if you smoke, you need a smoking cessation plan. Avoid drinking excessive alcohol. Be sure to take enough calcium and vitamin D. Avoid high-risk activities that could cause an accident. Another one is include weight-bearing exercise like walking on a regular basis. So in this case, okay, it's all of them. Now, smoking, be careful, because some questions are going to tell you reduce smoking. You don't want to reduce, you need to cessation, avoid, kaput, complete, goodbye. Avoid drinking excessive alcohol. We know that alcohol also has an effect on your health. Be sure to take enough calcium and vitamin D, right? So I will always recommend you not only remember this acronym mnemonic, sorry, is CDC. So C stands for calcium, D for vitamin D, and the last C is vitamin C. Okay, in this particular question, they are mentioning 2 of 3 factors, right? So it's calcium, vitamin D, and then avoid high risk activities that could cause an accident. Of course, you don't want to have any broken bone or hip, and include weight bearing exercise while walking because this is going to give strength to your muscles. Okay, now which serum laboratory finding is a concern for the nurse and should be reported to the primary health care? Okay, so we have calcium, and this 9 milligrams is between the normal levels. Know your calcium levels, especially for musculoskeletal, your calcium, your vitamin D levels, okay? Phosphorus 4.5 also is normal. Lactate dehydrogenase is 150, and alkali phosphatase is 210 units, okay? In order for me to motivate you to review, in some cases, I'm not going to provide you the normal level. So you can stop right now this recording, go and figure out what are the normal levels of your alkaline phosphatase, right? Your calcium, your phosphorus, and you have to review that. You have to review, you have to master this. So the answer is, should be reported, the alkaline phosphatase is 210 units. Okay, that's elevated. So let's go to another question. The nurse is assessing a newly admitted client. Which of the following findings would be a concern to the nurse regarding the client's risk for musculoskeletal health conditions? Select 3 that apply. Okay, in this case, let's start with the question, which of the following findings would be of concern to the nurse regarding the client's risk for musculoskeletal health condition? Okay, so we are looking right now for the worst option. Which one would be the concern? This is a new admitted patient. Select 3 that apply. So A, older adult over 80 years of age. B, history of osteoporosis. C, history of wrist fracture 50 years ago. 50 years ago, okay. D, was in a minor motor vehicle accident 10 years ago. Or E, is lactose intolerant. So which finding would be the concern to the nurse regarding the client's risk for musculoskeletal? So A, older adult over 80 years of age, yes, is very fragile. Now B, history of osteoporosis, right, is very important. And then we have E, lactose intolerant. Let me see what are we having in the rationale. Adults over 80 years of age are for risk for musculoskeletal. We know that, associated with aging, which make them vulnerable. A history of osteoporosis, that's option B, puts the client at risk of fracture. Yes, so B also is a correct response. Being lactose intolerant prevents many individuals from consuming dairy products. Haha, you see, that's a tricky one. You will never figure out that. Such as milk and cheese, which is rich in calcium. So calcium is needed to prevent bone loss. So there you go. Remember the mnemonic CDC, calcium, vitamin D, and vitamin C. If bone loss occurs, fractures can result. So that's why option E, lactose intolerance, is another option. Now, if you have a history of wrist fracture, okay, 50 years ago, that one may cause localized osteoarthritis, but it's not a concern at this time. Having a minor vehicle accident probably did not cause a major injury. A major injury could result in osteoarthritis or other musculoskeletal health problems in later years. Okay, so remember, in this question, the factor is the age because the patient is fragile, the history of osteoporosis, and the lactose intolerance, which make the patient to avoid dairy products, right? Milk and cheese. Another question, a client who had arthroscopy. Let's practice whatever I was telling you. Start with a question. What action would be the best for the nurse to recommend for this client at this time? So we're actually asking you the best recommendation. Now let's read the scenario. A client who had arthroscopic surgery for knee ligament repair, knee ligament repair. So this was done through a procedure in the joint, right? They are inserting a camera, arthroscopic surgery. Okay, reports increased swelling and pain 2 days after the procedure. So they did this procedure through the joint, and after 2 days the patient is having swelling and pain. So what is the best recommendation? Apply ice 4 times a day. Elevate the leg on 2 pillows. We are going to notify the surgeon immediately. So this client is reporting increased swelling and pain. Increased swelling and pain 2 days after. So we are going to notify the surgeon immediately or continue taking analgesia as needed. So the answer is notify your surgeon immediately. I know you're going to tell me, yes, Dr. Matalana, but you always mention the RICE protocol. Rest, ice, compression, elevation. But this is increased swelling. That's why it's very important. It's very important. First, you are going to read the question in the scenario. Second, you are going to look for adjective that is going to give you a hint of what is the condition, increase, decrease, okay? So this patient had a procedure, but after 2 days, there is an increase in swelling. So we need to tell the surgeon, ice is not the priority right now. Why this patient is having increase? They need to investigate, okay? Because swelling and pain indicate potential bleeding, infection, or another postoperative complication that needs to be assessed and managed as soon as possible. So that's why the correct answer is C. The nurse is assessing an older adult admitted to an assisted living facility. Let's read the question inside the question. Which of the following musculoskeletal changes of aging would the nurse expect? Which are the musculoskeletal changes that we are expecting on a client, okay, that is admitted to an assisted living facility? So we are going to check for scoliosis. Is that related to aging? Kyphosis, osteoarthritis, muscle atrophy, slow movement, jaw contractures. So we know already the answer. We review another question similar to this one, right? I told you we need to be focused. They are gonna bombard us from different angles. So scoliosis is not a musculoskeletal change related to aging. Kyphosis it is. Osteoarthritis also, right? Muscle atrophy also, slow movement and joint contractures. So we know the answer is B, C, D, E, okay? And so here they are saying that the joint contractures is not a normal finding of aging. Okay, so we're gonna correct that, and we are going to mention kyphosis, osteoarthritis, muscle atrophy, and slow movement. If you have any questions, if you have any doubts, always refer to your textbook, okay? It's very important. Always refer to your textbook. The nurse is reviewing serum laboratory test results for a client who sustained a fracture, and I always go by the textbook, okay? I don't like to mention something that is not there, okay? Even if in reality you can find different, because when you are having lack of movement, you can have a joint contracture, okay? That's why, and basically the older adults, sometimes they don't move as often, so that's why I was considering that possibility. Okay, let's base on the textbook. The nurse is reviewing serum laboratory test results for a client who sustained a fractured femur several weeks ago. The question is, which finding would the nurse expect for this client? Which finding are we going to expect on a client who sustained a fractured femur several weeks ago. Okay, a fractured femur. So which finding? Which laboratory? Decrease aldolase, increase calcium, decrease phosphorus, increase alkaline phosphatase. Okay, so this is a patient who had a fracture in the femur several weeks. So there's going to be a release of calcium into the serum. Release of calcium. That's why the answer is B, increased calcium. When bone is healing, calcium may be released into the bloodstream, causing an elevated serum level. Aldolase is a serum muscle enzyme. Now, you need to identify, and also is in any textbook, you have enzymes, right, that are only specific to muscles, and there are another one specific to bones. So you need to make the difference. Calcium is specific to bones, right? Aldolase is specific to muscle. So it's not going to be affected, right, by this fracture. Now, alkaline phosphatase, okay, usually increases when bone is diseased. That's important. Phosphatase when the bone is diseased, which is, it could be on bone cancer, right? Which is not the case on this test because this is a fracture. Although calcium and phosphorus usually have an inverse relationship, in this case phosphorus may also be released during bone healing, which can cause an increased level, not a decreased level. So let's be clear, when we are talking about bones, we are talking about phosphorus and calcium. Those are the enzymes related to bones. When we are talking about muscle, okay, we are talking about aldolase, okay, and we have to be careful with those. Review which enzymes are related to muscle and which enzymes are related to bones, okay. And we know that calcium and phosphorus has an inverse relationship. When calcium is high, phosphorus is decreased, okay, and vice versa. Now, the nurse is caring for 4 female clients. Which client does the nurse identify at higher risk for low bone density? Low bone density, right? So we are looking for the highest risk for low bone density. We have a 20-year-old Asian American, 36-year-old Native American, 48-year-old African American, 56-year-old white American. So the answer is D, 56-year-old white American tend to have the least amount of bone density of any group, which makes them more likely to have osteoporosis and fractures, okay? Very good. So next question, the nurse has completed health teaching about preventing musculoskeletal problems. The nurse has completed health teaching about preventing musculoskeletal problems. Which client statement reflects understanding of education? So now it is it is important to use a cane when I walk. B, I can drink a couple of cans of soda daily. C, walking 3 to 5 times per week is healthy. And D, if it hurts to walk, I will ignore the pain. And the answer is C. It is important to prevent falls in older adults. Okay, regular exercise is the most important element in healthy musculoskeletal aging, as strong bones and muscles can help to prevent musculoskeletal problems. Assistive devices may be needed for ambulation, but it's not a preventive measure. A nutrient-rich diet is an important part of maintaining musculoskeletal health. Soda is not a nutrient-rich. Let's go to the following question. So let's read the question inside of the question. Which question will the nurse ask the client before anesthesia is given? Which question, okay, the nurse will ask the client before giving anesthesia? Select all that apply. So a client is preparing to go for arthroscopy for surgical repair. We know what is arthroscopy, right? They are going to turn a camera through the joint. So which question is the nurse going to ask the client before anesthesia? When did you last eat or drink? Yes, That's correct, right? When was your physical therapy consultation? Because in that moment, the physical therapist is going to tell the patient they are going to give you anesthesia. This is what is going to happen during the surgery, blah, blah, blah. So also that is correct. Is someone here to drive you home later? Yes, the patient is under anesthesia. Do you understand post-care information? Okay, that's good to know also. Have you signed the informed consent form? Is that the most important? So all of them are, right, very important, and all of them are correct. So we're going to stop here. These are your basic questions, some of them, right? And then we're going to dive into the more advanced questions. Thank you. Don't forget to subscribe, because I'm gonna keep adding more questions to the channel. Don't forget to subscribe, right? And I'm here for you, Dr. Matalana, here for you always. This is your NCLEX, your review toward NCLEX for musculoskeletal. Thank you for watching.